Now, I'm very excited for our next speaker. She's an amazing advocate. She's wrote a paper on xenotransplantation, and she is the Director of External Relations and Patient Engagement. And Glenda Roberts, I'm going to pull you right up here because we thought it would be interesting to have the patient's perspective of xenotransplantation, because a lot of it's happening in the news, and I'm just really excited that you can be here today, Glenda. And what's your creatinine today, just so I can ask?
Oh, my creatinine is 1.29, and for me, that's in the low range.
It's that's wonderful. That's terrific. Well, I'll turn it over to Glenda, and she can give us some overview of her perspective on xenotransplantation.
And as Laurie said, this is going to be a patient's perspective. I work at the University of Washington, and I am active in a number of activities that may be of interest to this area. But in particular, I'm a member of a project with NYU where we are developing an ethics framework for xenotransplantation. And I think this is especially important because I'm the only patient on that committee. So we've got the patient voice going. So as Laurie mentioned, I am a person living with kidney disease. I have slowed the progression of my disease for more than 40 years using diet and exercise, but I did crash into dialysis after we started my workup 9 months earlier. And I can't help but reemphasize the point that Laurie made, and that is the importance of pushing the transplant center to make sure that they're moving you along that pathway so you don't have to have that experience. But it was a valuable experience for me, and it gave me a perspective as a patient. So now I understand in-center PD and kidney transplantation. And as we look at the opportunities for xenotransplantation, I'm especially excited to introduce my co-collaborator, Mary Ballaker. Mary was given the opportunity to write a paper on xenotransplantation from the patient perspective. And because she was working on a project with the Kidney Health Initiative, and I was working with NYU, she thought it would be interesting for us both to come together and share our perspectives. So what is xenotransplantation? You know, I have heard people provide a lot of different descriptions. So I went to the FDA to see what they said. And they describe it as a procedure that involves transplantation, implantation, and infusion into a human recipient of cells, tissues, or organs from a non-human animal source, or human blood, fluids, tissues, and cells and organs that have come in contact with live non-human animal cells, tissues, and organs. And why is it needed? Well, just as the doctor said previously, and Laurie says all the time, we have a shortage of organs. And so we're going to have to do something to reduce the number of people that are dying while they're waiting on the waiting list or dying while they are in dialysis. Both my brother and father died from kidney disease. My brother was on dialysis for 22 years, which is a really, really long time, but he still died while he was waiting to get a transplant. So in 2018, in the New York Times, there was an article where this was the cover page. It says, 20 Americans die each year while waiting for organs. Can pigs save them? And at the time, people were like, yuck. Well, one of the things that we know is that when scientists have looked at using other primates, you know, apes and other things that are closer to humans, we've gotten a lot of pushback because of the moral issues, shall I say, but also because there is some difficulty in getting those primates to cooperate with us as effectively. And they've had more success doing knockouts and knock-ins of pig genes in order to make them more compatible with humans. So a few months ago, there was an article in the NYU local university newspaper where they talked about the success of 2 heart xenotransplantations, where they had taken pig hearts, put them in 2 separate individuals. It lasted for 3 days, and then the people passed away, but they had to get special dispensation to do this. I mean, these people were so sick that they were not going to make it anyway, which is the reason I believe the FDA gave them the opportunity to do this testing. And, when we think about xenotransplantation, a lot of people go, eek, yick. I think there are a number of ways you can look at it. You can look at it as an alternative to allograft or traditional transplants, or you can look at it to bridge to the traditional transplant so that you're not living on dialysis. And if you've been in the dialysis scenario, I'm sure you understand what I mean when I say that it was really, really a difficult experience. And I take a pig, a horse, or a cow transplant in order to avoid that in the future. So here's what they did. As I said, they monitored them for 3 days. They used standard protocol, and I thought that was really interesting. When they were going about retrieving the xenotransplantation, they used the same procedure that they typically use with an allograft transplantation to make sure that they weren't introducing any anomalies into the process. The heart did function normally for 3 days, and they did not see any sign of rejection. And 2 areas that people are normally concerned about, for those of us that have transplants, most of us have CVM. Well, there's also something called porcine pig CVM that people frequently get infected with. And there's another virus that people get infected with when you look at transplanting pig organs into human or pig cells into humans, and they didn't see either of those. So that was a positive outcome for a relatively short study. And there was some concern about whether or not that operating room was going to be used again for regular procedures. And the university has taken it offline, and it will only be used for future xenotransplantation. So that was comforting. So one of the things that we have to think about when we think about xenotransplantation is, one, there are no near-term clinical trials. I mean, people are messing around with it, but there's not a major clinical trial that will be underway anytime soon. And that's because there are a lot of technicalities that need to be worked out. I'm biased towards the ethics questions that haven't been settled because that's the project that I work on. But there are also some other questions about, are we promoting well-being in humans? And what does well-being mean? Is it the length of survival? Is it the degree of medication management you have to do? Is it quality of life? It could be any number of things. So Mary and I wrote a paper that was just released this month, I'm very happy to say. And our premise was that we needed to consider xenotransplantation because of the organ shortage. We can't keep doing what we're doing. We know that whether you look at the data from the New York Times a few months ago, or you look at the data from other sources, we know between 10 and 20 people die every year while they're waiting on the transplant list. So we've got to slow down that process. And xenotransplantation, we believe, is one thing to consider, but there are a number of issues that need to be addressed. Now, our assumption is that older people who are not likely to be a candidate for a human donor will likely to be more interested or be the early adopters of this. People who are doing poorly on dialysis or have other health complications also might be interested, or those who can't wait on the organ list any longer just because their body is failing, once again, might be a candidate. And I did sort of a random study, completely non-scientific, let me say, in my transplant community. And I did a poll and I said, how many of you advocates, and there were about 20 of us, I said, how many of you advocates would be willing to sign up for xenotransplantation? And while everybody thought it was interesting, I was the only person that raised my hand. And I think it's because I align more with this profile than the average than the average advocate does. So I think that when people see where they are in the process, they're probably more open to xenotransplantation. Now, we don't believe that it is going to be easy to get through this process. We believe that it's going to require a sophisticated, informed consent. And that's going to require that there be a lot of transparency when your research coordinators or physicians or nurses are talking to people about the possibility of being involved in the xenotransplant situation. They need to be clear about what the risks and benefits are, and they need to describe the process in great detail. And that doesn't always happen. And the reason I want to share these details with you is that if you are a person who is faced with the possibility of xenotransplantation, if they don't raise these questions, then you should raise them yourselves. You know, there are lots of questions that you could ask in terms of how compatible are human and pig kidneys? You know, did you breed the kidney just for me? If the kidney has two kidneys, if the pig has two kidneys, did I get one? Where did the other one go? What kind of transplant therapies are we going to have to be looking at? As you can see, there's a long list. I encourage you to look at this list and take all of these issues to heart, because we don't want to get into a situation where we have people being willing to accept xenotransplantation and inadvertently get removed from the regular transplant list. And, you know, I don't think it's clear at this point whether or not you will be able to get a xenotransplant as a bridge, but still be on the regular transplant waiting list. You know, I think there are just a lot of questions that need to be worked out, not the least of which has to do with the lack of trust that we generally have in the healthcare system, especially when you look at underrepresented minorities, because we represent the largest percentage of people who are on dialysis and who have kidney disease. And there's a lot of distrust because of things that have happened historically. And this is not just syphilis or Henrietta Lacks, but there are just lots of research that has been done that people have decided isn't ethical. And there's also the other side where people have gotten advantage or because they had privilege. And so we want to make sure that we have a level playing field. And the best way for us to do that is to be strong patient advocates ourselves. So Celeste Castillo-Lee founded the Kidney Health Initiative's Patient and Family Partnership Council. And one of her beliefs was in the transformative power of the collaboration between patients, the healthcare staff, and the community to drive research and patient care forward. And I would argue that we are in a position at this point where, as patients, we should speak up, we should be active in this discussion so that, as the old African proverbs say, we can go far together. Thank you very much.
Thank you, Glenda, very much for your presentation. You know, your knowledge is extraordinary, and your service to people who have kidney disease is amazing. And a shout out to our corporate mission partners for making this happen.